Welcome to this explainer. Okay, let's dive right in. Today, we're taking a close look at two of the most fundamental processes that keep us alive, breathing and swallowing. Now, for most of us, these actions are completely automatic, right? We don't even think about them. But for patients who've suffered severe traumas or neurological events, these basic functions can actually become disconnected. When a patient needs prolonged mechanical ventilation, they often end up with a tracheostomy, a tube placed directly into the windpipe. But the big question is, how do we safely get that tube out? Well, today we're focusing on the science of decannulation. That's the medical term for safely removing a tracheostomy tube. We'll be looking specifically at how targeted rehabilitation exercises help in the decannulation process and actually prevent aspiration by retraining the vital muscle-nerve coordination responsible for swallowing.
Here's our agenda for today. 1. The complex swallowing reflex. 2. Tracheostomies and aspiration risk. 3. Screening for safe swallowing. 4. Retraining muscle-nerve coordination. 5. Expiratory muscle strength training. And finally, 6. The ultimate test, decannulation.
All right, Section 1, the complex swallowing reflex. So it's time to reframe how we think about something we literally do hundreds of times a day without a second thought. I want you to ask yourself, what does it actually take to safely swallow? Sounds like a super simple question. You chew, you gulp, the food goes down. But biologically speaking, swallowing is a massively intricate survival reflex. It's this huge physiological undertaking that has to happen flawlessly in a fraction of a second just to prevent food or liquid from going down the wrong pipe into your airway.
And get this, 25. A single successful swallow requires the precise coordination of over 25 pairs of muscles. Just think of it like an incredibly complex neuromuscular orchestra. Your brainstem and your cerebral cortex act as the conductors, firing off signals in this perfect sequence to make sure those 25 muscle pairs perform in absolute harmony.
And this brilliant orchestra basically performs in 3 distinct movements or stages. First, you've got the oral stage. That's where the food or liquid, what we call the bolus, is prepared and pushed back by your tongue. Then comes the second movement, the pharyngeal stage. This is a crucial, entirely involuntary part where your airway has to be aggressively protected while the bolus shoots down the pharynx. And third is the esophageal stage, where the bolus is finally squeezed right down into the stomach. The thing is, if the timing is off by even a single millisecond during that second stage, disaster strikes.
Which brings us to Section 2, tracheostomies and aspiration risk. We really need to look at what happens when that biological orchestra falls out of sync, especially for patients who have been on prolonged mechanical ventilation. We're dealing with two main antagonists here. First is dysphagia. That's the medical term for a swallowing disorder. Essentially, the muscle orchestra completely loses its rhythm and fails to safely transport food. And the immediate, highly dangerous consequence of dysphagia is aspiration. This is when food or liquid accidentally enters the trachea or windpipe. Aspiration is incredibly dangerous. It leads straight to recurrent pulmonary infections, like aspiration pneumonia, which is actually a leading cause of mortality in stroke and neurodegenerative patients.
And the sheer scale of this problem? It's massive. Acute onset dysphagia affects up to 67% of stroke patients within just the first 3 days. Now, I want you to imagine a patient who also has a tracheostomy tube in their neck for ventilation. That tube alters airway pressures and can even desensitize the area, which greatly complicates the body's natural biological barrier protecting the lungs. So, for these patients, the risk of aspiration just skyrockets.
Moving right along to Section 3, screening for safe swallowing.
Before a medical team can even think about removing a tracheostomy tube, they have to definitively prove that the patient's swallow is safe. There's a really rigorous, step-by-step protocol for deciding if a patient is ready for decannulation. It usually starts with an office-based transnasal flexible laryngoscopy. Doctors pass a tiny camera through the nose so they can directly observe the airway and vocal cords in real time. They'll often have the patient swallow colored liquids or semisolids right then and there. If they see any of that colored liquid slipping past the vocal cords and into the airway, meaning the patient is aspirating, well, the decannulation process is immediately halted.
Okay, Section 4, retraining muscle-nerve coordination. So what happens if a patient actually fails that test? This is exactly where the magic of rehabilitation comes in. We basically have 2 distinct ways to manage dysphagia. First, you've got compensatory strategies. These are behavioral workarounds. Think of asking the patient to tuck their chin, take smaller bites, or maybe drink thickened liquids.
Now, these definitely keep the patient safe, but they don't fix the underlying problem. Then we have rehabilitative exercises, and this is the real game changer. Rehabilitation actually targets the underlying brain-muscle connection to retrain the swallowing reflex and permanently restore function, which is absolutely crucial for eventual decannulation.
Which leads us perfectly into Section 5, expiratory muscle strength training.
Let's explore exactly how clinical teams get that swallowing orchestra back on beat to prevent aspiration. Speech-language pathologists actually have an incredible arsenal of evidence-based rehabilitative exercises. They use oral sensory training, neuromuscular electrical stimulation, and even transcranial magnetic stimulation. But for patients with tracheostomies, expiratory muscle strength training, or EMST, is an absolute standout. You see, because these patients have been on mechanical ventilation, their respiratory muscles are incredibly weak. EMST essentially acts as weightlifting for the breathing muscles. It helps them rebuild the crucial breath support and control they need to forcefully clear the airway if something goes down the wrong pipe.
And the neurological mechanism behind why EMST and these other exercises work, it's literally fascinating. When a patient does these targeted exercises, they are actively exploiting neuroplasticity. The exercises transmit intense sensory signals up to intermediate neurons in the brainstem and the cerebral cortex. The brain processes this information and then sends enhanced motor impulses right back down to those 25 pairs of swallowing muscles. Over time, this repetitive loop literally rewires the nervous system. It completely restores the brain's regulatory control over the swallow.
And finally, Section 6, the ultimate test, decannulation.
Once that muscle-nerve coordination is successfully rebuilt, it's time for the final exam. But removing the tube isn't just a quick, single event. It's a tense, high-stakes trial. At 0 hours, they block or cork the tracheostomy tube. Suddenly, the patient is forced to breathe entirely through their nose and mouth, using their own newly rehabilitated airway. For the next 48 to 72 hours, they are monitored continuously. The medical team is watching like hawks for any sign of respiratory distress, a drop in oxygen, or coughing while swallowing. If the patient passes this grueling multi-day exam without aspiration, the tube is finally removed and the hole in their neck is allowed to heal. So what are the results of this rigorous protocol? 87.5%. That is the impressively high efficacy rate of this simplified decannulation protocol in accurately predicting a successful, risk-free tube removal. It absolutely proves that when we properly screen patients and really rely on targeted neuromuscular rehabilitation like EMST, we can safely and effectively free them from mechanical ventilation.
Which leaves us with this final thought. Isn't it just amazing how the human body can literally rewire its own survival reflexes? I mean, from relying on a machine just to breathe to retraining a 25-muscle orchestra through sheer neuroplasticity, the resilience of our physiology is nothing short of miraculous. Thank you so much for joining me on this explainer, and I really hope you walk away today with a newfound appreciation for every single swallow you take.